ICDS age group 0 to 6 years. Second question, not included in negative symptoms of schizophrenia. Correct option is ambivalence. What is the first national program launched in India? Correct option is National Family Planning Program. Fourth question, INEP full form, Indian Newborn Action Plan. Next question, vitamin supplement given with isoniazid to prevent peripheral neuropathy. Correct answer is pyridoxine, vitamin B6. Vitamin B6 is given along with anti-TB drug isoniazid to prevent peripheral neuropathy. Which vitamin is not given along with the tablet methyl-dopa? That is a treatment for Parkinsonism. The correct answer is pyridoxine. Pyridoxine is not given along with methyl-dopa. Pyridoxine is given along with isoniazid to prevent peripheral neuropathy. Child becomes cyanotic while crying and X-ray show boot-shaped heart. The diagnosis is TOF, teratology of Fallot. The conditions included in TOF are PROV, P-R-O-V. This is the mnemonic for remembering TOF. P is for pulmonary stenosis, R right ventricular hypertrophy, O overriding of aorta, V ventricular septal defect. Next question, which is the bactericidal anti-TB drug? This question was some mistake is there. Only ethambutol is bacteriostatic. All others, isoniazid, rifampicin, streptomycin, these three are bactericidal drug. So this question was not correct. Ethambutol is only the bacteriostatic drug. Leishmaniasis is caused by, correct answer is sandfly. The testis flies causes sleeping sickness. 12th question, Kawasaki disease affect, correct answer is medium sized blood vessels, because major site of Kawasaki disease affecting blood vessel is coronary arteries. The coronary arteries are medium sized vessels. 13th question, purpose of adjuvant in vaccine to increase immunogenicity. Adjuvant is given to increase immunogenicity. 14th question, rotavirus vaccine is given dash to prevent dash. Rotavirus vaccine is given orally to prevent gastroenteritis. Correct option is B. 15th question, in normal labor, delivery of head by which maneuver? Correct answer is Ridgen maneuver. Delivery of head is done by Ridgen maneuver. The macrobot maneuver is the first line management maneuver used for shoulder dystocia. 16th question, most common cancer in females. Correct answer is breast cancer. Most common cancer in more than 35 years. Correct answer is CA breast. 2 questions correct answer was breast. CA breast. 18th question, visual inspection by acetic acid is used in diagnostic test used in which condition? Correct answer is CA cervix. This test is widely used in PHC based diagnostic test for CA cervix. 19th question, herd immunity is effective when? Herd immunity is effective when the whole population is immunized in a group. Blockage of foramen of Leschka and Magendie is which condition? Correct answer is Dandy-Walker syndrome. In PPH, first line management do in PHC before referral. Correct option is answer B. We should give oxytocin and IV fluids. Oxytocin to decrease PPH and IV fluids we have to give to prevent shock. In first option, visual inspection of vagina for finding the reason for PPH. Already we have diagnosed it is PPH. So next line treatment is we have to give immediate management to prevent shock and all and to decrease the PPH. If chest tube drainage system dislodged, priority action in pneumothorax patient is Correct option is answer B. Tip of chest tube in sterile anus. In this one, there is directly showing chest tube drainage system is dislodged. If chest tube is dislodged, we have to put adhesive tapes tightly at the site. Here it's clearly told the chest tube drainage system is dislodged. So, tip of chest tube in sterile anus. Next question, antidote for prostaglandin hyperstimulation of uterus. Correct option is terbutaline. This question was also a little confusing. All given options are tocolytics, magnesium sulfate, terbutaline, calcium gluconate. So correct option is option B, terbutaline. Dose of zinc for child 6 months to 5 years. Correct option is 20 mg for 14 days. 25th question, newborn SpO2 at 1 minute. Correct option is 60 to 65%. In PMJAY, Pradhan Mantri Jan Arogya Yojana, allotted amount per family is 5 lakh per annum. 27th, ductus venosus connect. Correct option is umbilical vein and inferior vena cava. We can easily remember ductus venosus means all are veins. So umbilical vein and inferior vena cava, both are veins only connecting. 28th, boy having sexually aroused when wearing woman's dress and he denies to change gender. Diagnosis is fetishistic transvestism. 29th, in umbilical cord prolapse, which position is given for the mother? The position given is Trendelenburg position to prevent further prolapse. Early symptom of engaged ICP in infant. Correct option is projectile vomiting. If there is shrill cry also, it is also the correct answer. 31st, non-bilious projectile vomiting, olive-shaped mass, weight loss and hungry child. Diagnosis is pyloric stenosis, and also there is visible peristalsis we can view from left to right. Most common cause of mortality in India is caused by TB. Next question, Talipes equinus first line treatment is option A, surgery. First line definitive management is surgery. Palliative care we can give casts and braces. Bright red bleeding per anus. Correct option is hemorrhoids. The other options, hematochezia means fresh blood in stool. Hemoptysis means blood in sputum. Hematomesis means blood in vomitus. 35th question, in IMNCI guideline, child came with fever, asked for history of. IMNCI means integrated management of neonatal and childhood illness. You have to assess history of malaria. Patient with DVT is on heparin therapy. APTT is 85 seconds. What is the priority action? We have to withhold the next dose of heparin or decrease the dose. Treatment of type 1 DM in child. The correct answer is insulin. In type 1 DM, the correct way of management is giving insulin. In Poshan Abhiyan, lodged by Ministry of Women and Child Development. 39th, respiratory failure in newborn assessment is done by both A and C. That is Downey score and Silver Anderson score. Both are used for assessing respiratory status in newborn. Symptom notes seen in heat stroke is option sweating, temperature more than 103 degree Fahrenheit, tachycardia and severe headache. Correct option is headache. All other symptoms we can see in heat stroke. 41. Scheme promote institutional delivery is JSY, Janani Suraksha Yojana. And there was a match the following question that was included double bubble sign. Double bubble sign is DD, duodenal atresia, and triple bubble sign is seen in jejunal atresia. For developing fine motor activity, which task you give? Kick a ball or clay modeling with the fingers. Fine motor activity is done with our fingers. So, clay molding with fingers. Sac-like protrusion contains CSF and neural tissue is myelomeningocele. Jugular vein distension is caused by hypovolemia and fluid overload. Correct option is fluid overload. 45th question. Patient very anxious about own health even though all medical investigations are normal. Correct answer is anxiety illness disorder, that is hypochondriasis. Patient with CKD, heart failure and serum potassium level is 6.8 milligrammes per liter. Priority action is options: hemodialysis, calcium gluconate, kyaxalate, K-bind. Correct option is for hyperkalemia for life-saving medication is calcium gluconate. In this condition, only serum potassium is elevated, so hemodialysis is not helpful. Kyaxalate and K-bind are oral potassium-binding agents for decreasing toxicity, but in this case, severe hyperkalemia is there, so it will be not useful. It will decrease the serum potassium level slowly. So to decrease immediately serum potassium level to normal, we have to give injection calcium gluconate. 47th question. Patient with ECMO, extracorporeal membrane oxygenation, developed hypoxia within normal setting. First priority is to check for clots and obstruction. Patient on jejunostomy feeding, important discharge advice is option A, provide upright position while feeding. Option B, if any blockage present in extension tubing, change it. Correct answer is provide upright position while feeding to prevent aspiration. Patient having dehydration due to diarrhea, serum sodium 130 milliequivalents per liter. First priority is to give option A, rapid infusion of hypertonic 3% NS. Option B, IV fluid 0.9% NS and correct dehydration. So, correct option is in dehydration to diarrhea, serum sodium 130. So, serum sodium is decreased. To increase serum sodium, normal level of serum sodium is 135 to 145 milligrams per liter. So, first priority, there is no need for giving rapid infusion of hypertonic 3% NS. We can give 0.9% NS and correct dehydration. Next question. Patient having heart failure and peripheral edema, serum sodium 128 milligrams per liter. Priority action is here serum sodium level is decreased. So, a patient having heart failure and peripheral edema, correct option is hypertonic 3% saline, because in heart failure we cannot give high volume normal saline, we cannot give, that is heart failure. And also if we restrict fluid and diuretics, if diuretics are restricted, heart failure will increase, heart will lead to more failure of heart. So the correct option is hypertonic saline 3% NS. National program for family planning is included in RMNCH plus A, reproductive, maternal, neonatal, childhood health and adolescence. Patient thinks his behavior has inserted a chip inside him that causes pain that is not his own, that is somatic passivity. 54. Client with myelomeningocele, nurse should monitor frequently for bulging anterior fontanelle because to assess for increased ICP. 55. Patient on nicotine replacement should be advised: A, chew quickly and shallow. B, chew slowly so that tingling and burning occur. Correct option is B, chew slowly so that tingling and burning occur. 56. 1 puff asthalin 6 hourly giving from 200 puff containing inhaler. For how many days it will be sufficient? So the question showing 1 puff giving 6 hourly, that means 4 times a day. So for 1 day 4 puff is needed. So total 200 doses are there in one inhaler. So 4 puff needed in one day. So 200 divided by 4, that is 25 days. 25 days we can use this 200 puff containing inhaler. Patient on haloperidol develop lip smacking, involuntary tongue movement. Correct treatment is option A, trihexyphenidyl. Here it's showing lip smacking, involuntary tongue movement. Sorry, tardive dyskinesia treatment is propranolol, not trihexyphenidyl. Here it's showing clearly the symptoms of tardive dyskinesia, lip smacking, involuntary tongue movement. These are all signs of tardive dyskinesia. Tardive dyskinesia is extrapyramidal symptoms of using antipsychotics. One of the EPS is tardive dyskinesia. So the treatment of choice is low dose propranolol. There was another one question, Schneider's first rank symptoms of schizophrenia. But options I forgot. These are all the correct answers. Schneider's first rank symptoms of schizophrenia. Delusional perception will be there. Thought broadcasting, thought withdrawal, somatic passivity, voices commenting on one's own actions, audible thoughts, and voices, arguing voices we can hear. Not we can, the patients we can hear, voices arguing. These all are the first rank symptoms of schizophrenia. Patient taking monoamine oxidase inhibitors, advised to give are avoid tyramine rich food because MOAs will cause cheese reaction. Cheese reaction is hypertensive crisis that occur when a person taking monoamine oxidase inhibitors consumes high tyramine food like aged cheese, cured meats, overripe fruits, that is banana, avocado, alcoholic beverages, and all. These all are tyramine rich foods. So patient taking MAOA should avoid tyramine rich food. BP 160-100, proteinuria 3 plus after 20 weeks of pregnancy, edema, diagnosis is preeclampsia. In eclampsia there will be seizure. In gestational hypertension only BP will be higher. In chronic hypertension it will be before 20 weeks. It's clearly showing it is after 20 weeks occurred. 61. Anemia Mukta Bharat target of HB is HB more than 11 gram per deciliter. BCG scar occur at, answer is 8 to 10 week. 63. Tobacco colored amniotic fluid is seen in intrauterine death. Which type of deceleration occurs in cord compression? Variable deceleration. In cord compression there will be variable deceleration. If head sinks in pelvic cavity, there will be early deceleration. For that we have to change the position. In early deceleration caused by compression of fetal head during labor. This is a normal finding. There is no problem. In late deceleration occurs in uteroplacental insufficiency. We have to provide supplemental oxygen for the mother. And in variable deceleration occur due to cord compression. We have to change position. 65. Bias minimized by using blinding in selection. That is performance bias. Each person gets equal chance in simple random. 67. Purpose of laryngeal mask airway is direct tracheal intubation. 68. Bougie or guide wire is used in difficult intubation. 69. Associated symptom in hyperphosphatemia is hypocalcemia. 70. BP cuff circumference should be 75 to 100% of hand circumference. Then only we can get correct value of BP. 71. Study by collection of historical data is retrospective case control study. 72. recurrent abortion plus antiphospholipid positive. The diagnosis is antiphospholipid syndrome. In antiphospholipid syndrome, there will be recurrent abortion. 73. Neuropathic pain is treated by gabapentin. 74. 6 cm dilation and contraction every 5 minutes. In labor, the priority action is monitor contraction and FHR. It's not the right time to bear down because after full dilation only we have to tell the mother to push. 75. Oxygen fluoride in resuscitation ambu bag is 15 liter per minute. 76. Sign in second stage of labor, that is full dilation of cervix. True about killed vaccine. For killed vaccine, booster dose is needed. 78. Drug calculation. One question was there for drug calculation. The correct answer was 45 ml per minute. 79. During subclavian central venous catheter insertion, dyspnea, absent blood sounds immediately occur. The diagnosis is pneumothorax. Along with subclavian central vein insertion, the common complication is pneumothorax. In femoral vein catheterization, central vein catheterization, common complication is infection. 80. During suction, SpO2 fall occurred. Initial action is stop suctioning and hyperoxygenate the patient. It is due to vagal stimulation. Bradycardia and SpO2 fall will occur during suctioning. Suction cannot do not more than 10 seconds. Within 10 seconds, we have to complete the suction. 81. Treatment for COPD with respiratory acidosis is give O2 via BiPAP to decrease the respiratory acidosis. 82. Before abdominal surgery, atropine is given to decrease the gastric secretions. Preoperatively, we can give atropine to decrease gastric secretions. 83. Highest risk for PPH is for twin pregnancy. 84. Using Packline formula for burns, total fluid volume for 24 hours is 4800 ml. For first 8 hours, how much to be give? That is 2400 ml. According to Packline formula is 4 ml per kg per percentage of body surface area, total body surface area burned. So, according to Packline formula, half of the total fluid calculated should be given in first 8 hours and the remaining half should be given in the next 16 hours, 1/6. So, here already given for 24 hours 4800 ml fluid is needed. So, for the first 8 hours, we have to calculate. So, half of this fluid should be given for first 8 hours. Half of this fluid should be given for the next 16 hours. 85. In intensive phototherapy, bilirubin reduction in 4 to 6 hours is 1 to 2 mg for 4 to 6 hours. Then only it will be called the phototherapy is effective. 86. Patient complaint of abdominal pain, itching, rashes during blood transfusion. First action is to drop transfusion. Anaphylactic reaction occurred. During resuscitation, ET placement is confirmed by capnography waveforms. 88. In ET ventilation, breath give per minute is 10 to 12 breath can be given per 1 minute. 89. Pelvic trauma with testicular injury. Patients should avoid catheterization. 90. 14-day child with fast breathing and yellow skin, there will be jaundice and also associated bacterial infection will be there. 91. Population pyramid showing wide base and narrow top. Wide base and narrow top. So, it is showing high birth rate and high death rate. And also, there is rapid population growth. It is showing rapid population growth and increased number of young people, that is showing the wide base, and decreased number of olders, that is showing the narrow top. 92. Patient with HFNC, that is high flow nasal cannula, need continuous humidification. Continuous humidification is needed to prevent injury to the mucosal epithelium. 93. Patient taking disulfiram should avoid alcohol and alcohol containing items, it will produce aversive symptoms. 94. Piperacillin and gentamicin injection should not give simultaneously, because if both are given simultaneously, it will decrease the effectiveness of the antibiotic. 95. Borderline personality management is dialectical therapy. 96. High mood before 3 months and now hypoactive. Diagnosis is bipolar 1 with mixed episode. That is depression plus mania. So that is mixed episode. 97. Highest protein is found in soya bean. There was another option. Egg also was there. But more than egg, highest protein is present in soya bean. 98. Injection hydrocortisone local use can cause hair growth in child. 99. Methyl dopa advice should be given is there will be dark colored urine due to the use of methyl dopa. And also there was one question regarding LP position related question. 101. Pancreatitis elevated enzymes are serum amylase, serum lipase and serum trypsin. These all are pancreatic enzymes. There was other option was lactase, I think. That was false. 102. One IBQ was there regarding ECG, that is showing first degree heart block. Treatment for that first degree heart block was transcutaneous pacing. 103. Nitroglycerin side effect immense severe headache because of vasodilation. 104. True about hypoxia. Cyanosis is the late sign. That was a true statement about hypoxia in that question. 105. Patient on ventilator showing increased peak inspiratory pressure. Primary action should be clear secretions by suctioning or check for any kinking or blockage. Blockage will cause increased peak inspiratory pressure. So we have to clear the secretions and remove the blockage by suctioning. 106. In molar pregnancy, we should check HCG weekly. 107. Cervicograph in abnormal labor will cross action line. There is alert line and 2 hours after action line. After, if we are crossing the time of action line, initiate the action, immediate action. That is lead to abnormal labor. 108. Opioid taking patient assessment. Important assessment is respiratory rate less than 10. Opioids like morphine will cause respiratory depression. So we have to assess for the respiratory rate. Opioid antidote is naloxone. 109. Purpose of Ayushman Bharat digital mission is universal health ID for all citizens. 110. Respiratory alkalosis occurs in pulmonary embolism. 111. Disorder of form of thought is tangentiality and circumstantiality. 112. Major cause of water contamination in India is coliform and nitrates. 113. Vasopressin effect in diabetes insipidus is urine specific gravity 0.015. Normal. In diabetes insipidus, there will be increased the excess amount of polyuria. So, urine specific gravity will decrease. There will be very reduced amount of solids relative to the volume of water. So, urine specific gravity will be less than 1.010. Normal urine specific gravity is 1.005 to 1.030. So, in the option, the urine specific gravity 0.015, it's normal. So, if you are giving vasopressin treatment to the diabetes insipidus, urine specific gravity will become normal. That is showing in this question. 114. Increased O2 in newborns will lead to ROP, retinopathy of prematurity. So, newborns are assessed regularly. Newborns receiving oxygen, regularly assessing for ROP in NICUs. Then 115. Unconscious patient with no gag reflex use Oropharyngeal airway. Oropharyngeal airway is contraindicated in patients with a good gag reflex. Nasopharyngeal airway is contraindicated in patients with a basilar skull fracture. Here it's showing asking unconscious patient with no gag reflex. So we can use oropharyngeal airway. 116. Dilated pupil, increased heart rate, increased BP is seen in acute pain. Other options were neuropathic pain, chronic pain was there. 117. Nurse's role in conduct disorder is strict rule and regulation. 118. Less than 100 ml urine output in 24 hours indicate anuria. 119. Even after suctioning in 80 patients, suddenly developed a new wheezing due to laryngospasm or bronchospasm. 120. There was an IBQ regarding jugular vein distension. Jugular vein distension is seen in increased fluid overload. 121. There was also other IBQ showing epidural analgesia. Another IBQ was there regarding lever retractor. 123. There was an IBQ regarding late deceleration in pregnancy. 124. There was an IBQ showing obstetric V-shaped drape. 125. There was an IBQ regarding green Armitage forceps like this. Tip was like this one. 126. There was another IBQ regarding Haberman feeder. It was also that picture of Haberman feeder was also asked in last year Norcet 8 mains also Haberman feeder question asked. This question was repeated question. Thank you.